Well, a warm welcome to this talk. I hope you're having a good Easter. It's still Sunday, the 17th of April. Now, just a very brief video today. I've had lots of questions from concerned parents about an apparent outbreak of hepatitis in children. Now, hepatitis, of course, is inflammation of the liver, just located underneath the right costal margin, inflammation of hepatitis of the liver. Now, just let me give you the bare bones of this. There is an outbreak of hepatitis in children. There's been 74 cases in the UK so far, and in the United States, the only cases reported so far are in Alabama, where there's been 9 cases, but we are expecting further cases to arise. Is this a complication of COVID? It's possible. It's a complication of SARS coronavirus 2. We simply don't know. It may not be. Is this a complication of COVID vaccination? Well, I think we can say fairly definitively that so far, no, it's not a complication of COVID vaccination. Now, I can think of some arguments against vaccinating children, but this does not appear to be one of them. Where will it go? Well, it could just vanish and be never heard of again, or it could develop into more cases. And if it vanishes, then we'll probably leave it on this channel. If it does develop into more cases, of course, we'll keep an eye on that, because it is concerning, because quite a few of these children do actually seem to be quite ill. So even though there's not a huge number of children, thankfully, involved, under 100 at the moment, or about 100 at the moment, because there's a few in Europe as well, they do seem to be getting quite ill very often, which, of course, as a parent is pretty frightening. So that's the bottom line of that. If you haven't got time for the rest of the video, if you have, I'm going to just put a bit of detail on that from the World Health Organization and from Medline. So let's look at that in a little more detail now. So this is the World Health Organization report, acute hepatitis of unknown etiology. That's the UK spelling, that which causes disease. In the United Kingdom and Northern Ireland, but as we said, Alabama as well. So WHO monitoring cases of hepatitis in children across the UK. Now, in the UK, it's children up to the age of 10 that seem to have been affected so far. Now, of course, we do expect, although in the UK it's not common, but we do expect globally cases of hepatitis in children because of viral hepatitis. And we name the viral hepatitis viruses A, B, C, D, and E. So it makes it quite easy. When I used to teach this to my students, it was quite easy because of the letters. But let's just look at what these mean. Now, hepatitis A, that's an infectious hepatitis, normally fecal oral. B and C, both of those are what we call a serum hepatitis. So they can be transmitted sexually, but more commonly in contaminated needles, for example, amongst intravenous drug users. And tragically, healthcare providers occasionally have caused the transmission of the disease. And of course, this is the same modality of transmission as HIV. So unfortunately, HIV and hepatitis B can sometimes go together. But anyway, hepatitis E is more of a serum hepatitis, fecal oral one. That can occur, E can occur in outbreaks in refugee situations, for example, not common. And hepatitis D, D only occurs with hepatitis B, superimposed hepatitis B is what we call a piggyback virus. But anyway, they've been excluded, so it's not those. So it's not the common types of virus that cause hepatitis. So at the moment, it is a bit of a mystery. Now, of the children in the UK, 6 have had liver transplants. Now, presumably, you would only do a liver transplant in a child if otherwise they were going to die, because, of course, firstly, you've got to source a liver from a child that's tragically died of something else, or at least a part of a liver can sometimes be donated from an adult. Because if you can donate part of the liver, it will actually grow with the child, so that's sometimes done that way. But of course, it means that the child who receives it has to be on lifelong immunosuppressing therapy to stop them rejecting the transplanted liver. It's a massive procedure. In anyone, but for a child especially. So the surgeons wouldn't do this unless there was some compelling reason, like the child was going to die. So we can conclude from that there's been some pretty sick children, unfortunately. Scotland, 10 of the cases in Scotland, so the 10 cases in Scotland had severe acute hepatitis. Acute means of recent onset, so this comes on quickly and it's severe. And that's out of 13. So that is part of the reason I wanted to cover this, because if 10 in 13 cases are severe hepatitis, then that's really quite concerning. This is potentially quite a nasty causative agent, whatever that turns out to be. The rest of the UK, 74 cases. That's kind of a bit of a breakdown there as to where those cases are occurring, but they are throughout the United Kingdom. Spain, 3 identified so far, as we say, probably more to come. Older child, a 13-year-old, was involved in Spain. Denmark, we don't know how many. Netherlands, we don't know how many, but there are some. So this is Europe, and the UK seems to be most common in the UK. But of course, unfortunately, there may be more cases in the States as well. We are expecting actually some more cases in the States. Let's hope it's very few, and this is very, very self-limiting. But at the moment, we're waiting to find that out. European Centre for Disease Prevention and Control. It's telling nurses and doctors to look out for jaundice, the yellow discoloration. Jaundice very often begins first in the white part of the eye that gets a bit yellow, and it can spread to other parts of the skin, this yellowish discoloration as bile pigments can accumulate in the blood if the liver's not processing the broken down components of the red cell into bile as normal. Vomiting, of course, with any sick children get vomiting, stomach problems. Now, other things I've included here to look out for with hepatitis: muscle and joint pain, as you can get with any febrile, any fever condition. Nausea, just feeling sick, tired all the time. General sense of unwellness, general malaise. Loss of appetite is a common one with liver problems. Localised pain in the liver. And of course, you'd expect that to be where the liver is, which is here underneath the right ribs. Under there is where the liver is. Upper right side of the abdomen. Dark coloured urine, because again the bile salts are being excreted in the urine, not processed into bile, and because the bile salts aren't getting into the gastrointestinal tract to colour the faeces, it can be pale or grey coloured faeces. And itchiness again is caused by the bile salts in the skin. Patients with liver failure can be distracted to states of abject torment with itching because of the bile salts in the skin. Now let's look at the cases in Alabama now. So Alabama, 9 cases that we know of for sure, between 1 and 6. And again, 2 of these have had liver transplants, so presumably 2 of this 9 would have died without intervention. Now this is really, this is the concerning part here, that the high proportion of severely ill children as a result of this hepatitis, whatever this inflammation of the liver turns out to be. No epidemiological links so far in the States. So now in the UK I think there is one I'm not sure, we'll come to that. In the UK I think there's one epidemiological link. 2 cases seem to be linked, but it's tentative at the moment. But in the States they're not epidemiologically linked. In other words, you can't say that one child had contact with another child, or they had contact with a common carrier of a potential infection. So not a lot to go on there. Now, in Alabama, they suspect what's called Adenovirus 41. Now, Adenovirus is very common. All children get it. Basically, adenoviruses can cause infection anywhere. Very often, they cause upper respiratory, common cold type features, but they can cause a sort of a gastritis and a gastroenteritis. They can even cause urinary tract infections. And we've all been exposed to these adenoviruses, and in adults most people don't get significant infection from them because we've developed immunity to them. It's very often that these are associated with childhood, so I am immune to many types of adenoviruses. I know that, otherwise I would be constantly getting adenovirus infections, because adenoviruses are ubiquitous. They're all over the place. No viral genetics yet, so there's nothing to relate the different cases of the Adenovirus 41 that have been discovered to each other. When they are, they'll be able to work out if they are related, if they have genetic similarities, like they're in a family tree of potential viral infections with similar genetics. That's not done yet. So adenovirus 41, still very much a question mark. It may turn out to be something completely different, but that's what they're speculating in the States because some of the cases tested positive for that. Now, adenovirus is known to cause hepatitis in immunocompromised children. This is a well-known problem in hospitals, for example. These children, as far as we know, haven't been immunocompromised before. So why should they get severe adenovirus hepatitis if they're not immunocompromised? It doesn't quite add up at the moment. As I say, we're not really sure. But more cases are expected in the States and the UK, according to authorities. As of the 11th of April, no hepatitis deaths recorded. But as we said, the 2 in the United States would have died without a liver transplant. And was it 6 liver transplants done in the UK? I can't remember. I think whatever it was. I think it was 6 in the UK. So presumably 8 children would have died without liver transplants already. That's right. In the UK, 1 epidemiological link case, but we don't know if that's linked to a. So if one child is linked to the other child, is that the link? We don't know, or if they come from a common cause, a common source of the virus. We don't yet know. We just know there's 1 epidemiologically linked case, and of course, if there's an epidemiologically linked case, that does tend to indicate that this is infectious, transmissible in nature. Well, of course, we'd need more detail on that. But so far, from what we know, it looks like this is some sort of transmissible infection. Probably a virus, but it could be a bacteria. Very unlikely to be a fungus, probably a virus, but it could be a bacterial infection. That is quite possible, but I suspect we're looking for a virus here. I'd be surprised if it turned out to be anything other than a virus, but of course, we simply don't know at the moment. So the epidemiological link means they've had a link with each other or a common source. So Dr. Marie Chan, Director of Clinical and Emerging Infections, UK Health Security Agency, direct quotes from her, investigating a wide range of possible factors which may be causing children to be admitted to hospital with liver inflammation. So she's looking at a wide range of possible factors quite correctly. One of the possible causes that we're investigating is this link to adenovirus infection. Now, we believe of the 74 cases in the UK, about half have tested positive for adenovirus. But again, that's not surprising because there is a surge of adenovirus infections in the UK at the moment. So presumably the normal adenoviruses that would circulate and cause immunity in children all the time during the COVID restrictions, there was less mixing, although with children they've been mixing for quite a while now. But it's as if these adenoviruses are now catching up and exploiting the etiological niche in children that aren't yet immune to the virus. So it seems to be one of these catch-up things after the pandemic. We're seeing the same with other viruses, such as the respiratory syncytial virus, for example, which was a lot of infections from that. It just shows that all the time we're getting these natural viral infections and making immunity to do these. And if we have a gap where we don't have normal mixing, the viruses kind of have to catch up because we live in this ecological milieu of untold millions probably of viruses, probably billions of viruses, hundreds certainly that can cause infections that we know about. So adenovirus infection is common throughout the UK, but they're investigating other possible causes. Now, SARS coronavirus 2 has been detected in several cases, of course, because this is massively prevalent in the UK at the moment. Does that mean that these cases of hepatitis are caused by SARS coronavirus 2? It could do, but there's so much SARS coronavirus 2 around in the UK at the moment, it would be pretty amazing if some of these children diagnosed with hepatitis didn't have concurrent infection with SARS coronavirus 2. So that's not remotely surprising. Of the 2 contenders, the SARS coronavirus 2 or the adenovirus, I would certainly go for the adenovirus at the moment. But it's atypical for an adenovirus. I think we could say that. We can say that. Officials stress no link with the COVID vaccine. So this is not making any comment at all about vaccinating children. There's arguments against that. There are arguments for it as well, but there's arguments against that. But that's not what we're talking about here. There's no link. The officials have clearly, definitively stated there's no link with COVID vaccine, as none of the children in the UK that have had this hepatitis have been vaccinated, we are assured. And we have to take them at their word on that. I'm sure that's true. None of them have received, when I say a jab there, of course, I mean a SARS coronavirus 2 jab. So infections, we need to do more studies. Chemicals, could it be caused by chemical toxins? Possible, but unlikely. Or other toxins, again, possible, but unlikely. And the international presentation, so the likelihood of having a toxin problem in Alabama, Spain, Denmark, Scotland and England all at the same time is pretty remote. So I'm pretty sure this is going to turn out to be some kind of infection, probably viral, but that's all we know yet. It may be something other than adenovirus. Dr. Chand again from the UK Health Security Agency. Normal hygiene measures such as good hand washing, including supervision in children, fair enough. Respiratory hygiene may help to reduce the spread of many infections we're investigating. But again, these adenoviruses that are spreading around our children now, it's not as if you can stop them. These are adenovirus utterly endemic. We can't stop adenovirus infection. That is completely impossible. There's quite a few of these. There's a lot of these viruses, and they're just part of life. And in fact, they may be a good part of life because when the immune system comes to these viruses, it stimulates the immune system. That helps the immune system to recognise antigens, non-self, differentiate that from self. And there's also some evidence that infections might stimulate our ability to combat cancers in later life. So these endemic viruses aren't bad. I mean, they're not good. They're just part of this massive ecosystem that we live in. As we said, this milieu of life that we are submerged in on the surface of this planet. We're also calling on parents and guardians to be alert for the signs of hepatitis. That's a good point. And I think we might just we looked at some of these, didn't we? Just quickly reinforce that. So the classic one is the yellowing, the jaundice. Now, the vomiting and the stomach problems, that can go with hepatitis, but it can also go with gastrointestinal viral infection, of course. And basically, you've got a sick child who might have some localised pain, but be very sensitive to any yellowing in the eyes. So look at the whites of the eyes, the sclera, and see if there's any yellowing in there. Look at those under good light and see. That's where it shows first. It shows first in the eyes. But the other things that are sort of specific to liver problems are dark coloured urine, especially if the child is well hydrated, and the pale faeces, and the itch, the itchiness. These are more specific. The itch can be anything, but these are more specific. So the jaundice, the dark urine, and the light coloured poo, much more likely to be directly liver related. Whereas these ones are just any infection, any children can get these ones. So of course, go to your healthcare provider if you're worried about any of them, but particularly if there's jaundice, changes in the colour of the dark coloured urine, pale poo or itchiness, do take medical advice on that as soon as you can. So again, Dr. Chand, what's she saying? Yeah, including jaundice, okay. So obviously go to a healthcare professional if you're concerned about your children, but do be particularly aware for the jaundice, the dark coloured urine, the pale coloured or grey coloured poo, and the itchy skin. Or another one that would indicate really more severe disease is bruising. If a child is bruising more readily or taking time for bleeding to coagulate, because it's the liver that produces the coagulation factors in the blood. So there we go. Hopefully this will come to absolutely nothing and we won't need to talk about it again. Maybe just a quick mention that it's gone away now, which we're severely hope will be the case. But we will keep an eye on it. There could be more cases in the next weeks. In fact, we're expecting more cases in the next weeks, but where it'll go, we don't know. Am I expecting a sort of a widespread pandemic of this? Well, no, I sincerely hope not. I really think what we're probably dealing with here is viral infections that children would normally be exposed to stimulate their immune systems. Means that a lot of children have somewhat understimulated immune systems due to the lack of social mixing during the pandemic. And this is just kind of the virus is catching up. So let's hope they've caught up now, but it is something we'll keep an eye on. But at the moment, while this is massively significant for the children infected of course, and their families, I'm not expecting it to become widespread. But it's a concern, and we're going to keep a close eye on it. And enjoy the rest of your Easter weekend.